Hi guys, it's Mandy. For my article for research, I read the effects of motivational intervention on blackouts among college freshmen. And the authors of this article are right here. I don't want to butcher anybody's name, so I won't go any further than that. For the significance of the problem, we have, as everyone knows, blackouts are common among college students due to drinking and drugs, and there's an increased risk for this behavior, which increases the likelihood of having a blackout. So college students are more prone to drink, so they're more prone for a blackout. First 6 to 8 weeks is the highest risk because they're exploring new things. The reaction by most people is negative. They're very scared. That being said, there's more females than males reporting that they have experienced a blackout, and 1 in 10 students experiences a blackout. During these blackouts, anything can happen from sexual assault, violence, memory loss, trauma, or death. And motivational interviewing could decrease these blackouts. There is possible that teaching this in nursing school would be beneficial to the future. That way we can prevent and intervene early. As for the literature review, there is campus environment and social factors that predispose students to this risky behavior. There is a clear association with alcohol and drugs with blackouts. Students are using marijuana, cocaine, heroin, hallucinogens, anything along those lines, and together this makes an extremely high risk factor for a blackout. There are more than 250 million people ages 18 to 25 that engage in this high-risk behavior that dramatically increases the likelihood of having a blackout. These blackouts are associated with memory loss, either before intoxication, forgetting what was going on, that's called retrograde amnesia, or more commonly anterograde amnesia, which is after one has already become intoxicated. The problem is that this risky behavior is resulting in serious consequences such as sexual victimization, vandalization, unplanned pregnancy, suicide, and so many other things. And the students don't even recall that anything happened. So this research here is intended to determine if motivational interviewing can decrease the likelihood of these blackouts and even prevent this risky behavior. The design was a quasi-experimental design, or as the researchers state, a longitudinal design. Initially there were 300 students, and they narrowed that down to 188 by the following criteria. They had to be freshmen, 18 to 20 years of age, full-time student, consumed alcohol in the last 30 days, read and speak English, and willing to participate in all 4 of the sessions. The variables were independent was alcohol and drugs, and dependent was the blackouts. Data collection, there was a baseline assessment that was done first, and then 2 weeks later there was another one, and then 3 months, and then 6 months. At every visit, the students received a $20 gift card to the school bookstore, and at the end, for participating, they all received an $80 gift card for the bookstore. These interviews were done one-on-one. There were questionnaires, and the interventionist gave out education and also gave positive feedback to each and every student. The findings were that this significantly decreased the weekly number of drinks that students were having, the number of hours that they were drinking, and the number of days, and drug use decreased as well as blackouts decreased. But there was also a small amount of participants that didn't have blackouts in the beginning at the baseline assessment, but did report having a blackout by the end of the 6-month period due to drinking more alcohol and partaking in drugs. Limitations for the study were the fact that it was limited to one university, so we can't say that all universities are going to be the same. And students could choose to participate or not participate, so it wasn't randomized in any way. Also, a big one is that there was self-reporting, so were these students honest? And it was very labor-intensive. The interventionalists were saying how much time it took for them to spend on this. There were 6 interventionalists and 180 students, so it was a lot per person. Implications, useful in healthcare clinics. Again, prevention and intervention. 2, the healthcare team in universities is where our main goal would be. That way we can benefit from the MI training right on the spot and prevent these college students or intervene as soon as possible. Also, if we can instruct in nursing schools, we can include interdisciplinary focuses and encourage collaborative research. We can address these concerns at a younger age, potentially preventing the risky behavior later on. And also it could be a key component in prevention and intervention programs that are already out there. As for conclusion, it's clear in this article that the MI program is beneficial in preventing high-risk drinking and consequences. If we can have this in our clinics, it may be effective to target behavior problems. And also it can be a guide to healthcare providers globally to develop and promote effective interventions for those engaging in such high-risk behaviors. Overall, it was a good article, and I hope you view my PowerPoint.